These are our highest awards of the year, and the people who inspired these awards really contributed a lifetime's effort to what we're doing here, what we're continuing here, and their legacy really lives on, and they're missed and they were loved, and so I'm really pleased to be able to go through with you our nominees for the awards for this year. And so Riley is going to tell us a little bit about the actual award, because we're not in person, and so we can't give the awards to people physically. Oopsie, sorry. So go ahead, Riley. This is kind of exciting and interesting.
So we've actually commissioned our awards to be made from one of our members and a supporter, Doris Y. And Doris actually reached out to us after she lost her grandmother at tender care from COVID-19. She was inspired to become a long-term care advocate after this, and she's been instrumental in sharing her story at our press conferences, as well as finding us other speakers and getting us in touch with other families at tender care as well. And she wanted to do more. So what she ended up actually doing was selling Christmas tree ornaments with hand-etched names in them to remember someone who's been lost. And she donated $5 from every ornament that she sold, and she actually managed to raise over $1,000 last year for our work. She actually is an artist from Toronto. She has a small studio, and she does hand etching and hand lettering and calligraphy, and her website is lovelettering.ca. If anyone's curious to see her stuff, it's very beautiful. So when we had to make these awards, we thought it would be amazing to ask her to commission some unique pieces for our recipients.
Thanks, Riley. And thanks to Doris for her contribution. I mean, just amazing, really neat. So we're going to lead with the Dan Benedict Award. So Dan, sorry about the picture. You know, some of these people kind of predate the internet, and there just are not good photos of them. And our office has been closed since the beginning of the pandemic. So we're all working from home. So not the best photo at all. Dan might murder me if he saw that. But anyway, Dan was an amazing person. He died in 2003 after a battle with cancer. And he really was just an extraordinary human being. Some of you in Unifor, formerly the CAW, would know him. He was incredibly accomplished. He did 4 years of military service in World War II. He went on to earn his doctorate in economics. He acted as an adjunct professor of graduate studies in sociology and a visiting professor of political science at York University. He taught industrial relations at McMaster and Laval universities. He joined the Canadian Auto Workers, the CAW, as a staff person, and eventually retired as international director, but not really before leaving an incredible legacy. The paid education leave program, which is kind of an in-depth adult education program for working people, was his brainchild. He made significant contributions to worker education in Latin America. And for those accomplishments and his many contributions for social justice, workers' rights and education, quality public health care, justice for seniors, and as a tireless campaigner in the cause of international solidarity, he was awarded the Order of Canada in 1998. He was also a very capable communicator, and he spoke 7 languages. When he spoke English, French, Spanish, Portuguese, Italian, German, some Finnish, Hungarian, and Swedish. And just prior to his death, when he was in his 80s, he was learning Russian and Mongolian. He served as a co-chair of the Health Coalition. He was a founding member and co-chair. He served also on the board of directors of the Ontario Coalition of Senior Citizens Organizations. And Dan's contributions to global social justice are really extraordinary, and he's warmly remembered, you know, right through Canada to Europe to Latin America. So every year, the Dan Benedict Award is given to the person or persons who, working with one of the local health coalitions, best embody Dan's extraordinary spirit of community activism and commitment to the protection and extension of public Medicare.
Great.
And so this year, we would like to award the Dan Benedict Award to Ed Cashman, Mary Catherine McCarthy from the Ottawa Health Coalition,
Wow.
Kevin Scarrett, also from the Ottawa Health Coalition and from the campaign to make Rivera public, which he inspired and founded, and Nancy Parker, also from the Ottawa Health Coalition and from the campaign to make Rivera public. And so I just thought we might give them an opportunity to say a few words. Yeah. Yay!
And some people are
clapping.
See, we can still clap and also use our little reaction button.
That's right. Thank you. And
Thank
so Ed, Nancy, Mary Catherine, Kevin, can you say a few words?
Sure. Nancy will be speaking for the group.
Okay.
Great, thank you.
Where are you, Nancy?
Hi there.
There she is.
Yeah, I just want to say thank you very much. This is something that's really been needed because of the terrible, terrible outcome in Rivera. It was also inspired by the connection of the ownership owned by the pension plan that so many people are, when they find out that their pension plan is making profits from literally the deaths of people in long-term care. It's definitely been a joint effort. We had a lot of support from the Ontario Health Coalition, and certainly couldn't have done it without the support of the executive of the Ottawa Health Coalition. I think at this time, I'll turn it over to Kevin. He really is one of the driving forces behind this campaign, and he keeps it alive. Thanks.
Thanks, Nancy and Natalie and Ontario Health Coalition. I don't have anything to add to what Nancy said, except maybe I'll just mention in passing that we owe a lot, not just to the Ontario Health Coalition, but also to the Public Service Alliance of Canada, which actually really needs to be credited with sort of getting the attention on Rivera and this pension fund connection really launched in May of 2020 at the height of the first wave of the pandemic. And I'll also just mention to close that the Rivera campaign, the Make Rivera Public campaign, it continues, and in some ways it continues to grow. We learned recently that the Canada Post Pension Plan, Canada Post Pension Fund, is actually a co-owner of some of the Rivera homes. So postal workers, current and retired, have a linkage to Rivera's profit making that we actually weren't aware of prior to November. So just, you know, for those watching, stay tuned. I think there's going to be future chapters of the campaign to make Rivera public coming your way soon.
Great, thanks. We look forward to that. Thank you.
Thank
Okay,
you.
Natalie?
Yeah, no, I don't, Marilyn and Matthew, you have your hand up for some reason?
This isn't, yeah.
I don't know what that's about. Okay.
Oh, I'm sorry. God.
Okay.
Okay.
Okay. So the Ottawa Health Coalition, the reason why we gave the award to them is because they have been incredibly active, and they've done really a brilliant job of organizing, deeply organizing in their communities, as Rachel talked about, going out to events and acting in solidarity with others, organizing campaigns and events in their community, really building the Ottawa Health Coalition, and then inspiring this movement across the country. And really pushing and inspiring and making it happen to push that the federal government, which has the power to do it, you know, has the absolute power to do it, would make Rivera public. And so thank you, heartfelt thanks from all of us for your incredible leadership. I think Dan would be incredibly proud. In fact, Dan was talking about pensions investing in for-profit long-term care and healthcare a lot before he died, and really trying to push organizations from inside around that as well. And it was an issue near and dear to his heart. He thought it was horrific that workers' pensions would be used in a way that was so fundamentally against the interests of workers. And so thank you very, very much for everything that you've done. And now I'm going to move on. I just need to ask, is Dr. Tara Moriarty, if you're here, because we don't see you, could you put something in the chat? It could just be that her name on the screen is not Dr. Tara Moriarty. And I'm going to move on then to the next award. Okay. Sorry. So Orville Thacker, this is the Orville Thacker Award, and Orville Thacker was a dedicated advocate and activist. He died in October 2013 after a 5-month battle with cancer. He was 81. He was born in Kincardine, Ontario in 1932, raised on a farm, moved to Kitchener in 1949, just at the end of the war, and joined the United Rubber Workers Union, maintaining active membership until he retired in 1995. He enlisted in the Canadian Armed Forces in 1950 during the Korean War, and he served for 3 years. He was an active member of his community for more than 60 years. He was a member of the Royal Canadian Legion for more than 50 years. He held office, every office in Local 677 of the United Rubber Workers Union. He was the president of the Kitchener-Waterloo and District Labor Council for 8 years, and also a longstanding member of its executive committee. He served and was a longstanding member on the Executive Council for the Ontario Federation of Labor until his death. And he served for 10 years on the board of the Central Ontario Exhibition, including 2 years as president. He was for 9 years on the Kitchener-Waterloo Hospital Commission, as well as many other municipal committees. He was deeply committed to focusing attention on social issues affecting Canadian families. He was a member of the Ontario Health Coalition and a founder and co-chair of the Kitchener-Waterloo Regional Health Coalition. He attended many conventions for seniors organizations, labor, and justice. He formed and managed campaigns for local candidates for municipal, school board, provincial, and federal office, authored many presentations to governments at every level on a wide range of social justice issues, and will always be lovingly remembered and deeply missed. He was deeply committed to furthering the cause of protecting seniors and seniors' access to healthcare services and improving them and protecting them as public services. He worked with me and with us at the Health Coalition for many, many years, and it was extraordinary in his commitment and hard work on it. His award, the Orville Thacker Award, recognizes exceptional commitment and contribution to improving quality public health care for the elderly in Ontario. And it's awarded to a person or organization whose voluntary contribution supports the fundamental principles of the Canada Health Act, equity and compassion, the principles that underlie public Medicare in Canada. And this year, I'm very happy to say that the award is going to 2 recipients, one who couldn't be here and who might also kill me if she saw this picture. It's Sandra Coletta, and Sandra lost her mom. She can't be here today. She actually has to work and just could not get out of it. She lost her mom early in the first wave of the pandemic in a long-term care home. And she went on to organize families into a group, a Facebook group called Ontarians for Ltc Reform. And this group is huge. It's about 4,000, mostly families and some workers as well in long-term care. And people go to it to ask questions about, how can they get into long-term care? How do they figure out which homes are better and which are worse? What are the standards around food or around cleaning or around levels of care, all kinds of very in-depth questions. They share information, they're activists, they join in every activity that we do. She has helped to find families from everywhere around the province for media when we need to get families to speak for media. She's tireless, she's a sweetheart to work with. And she does this work of organizing that really no one until now has ever done. And it's a lot of work. She's learned the legislation, the regulations inside and out, and really operates in a way that I think we would all be so impressed with, with accuracy, trustworthiness, gives the correct information, really supports the families, and just is so deserving. And so Sandra said to me that she is, both embarrassed and pleased and so happy to accept the award. And the next person is Jane Meadis, and she's here with us today. And Jane she's extraordinary. She's a lawyer and at the Advocacy Center for the Elderly, which is a legal clinic focused particularly on issues around the elderly. She's the institutional advocate, so she does the work on long-term care and all of the legal issues, helping literally thousands of families. She's done it for at least 20 years. She is so generous with her time. We've talked at night at, 11 o'clock at night, midnight, 1 o'clock in the morning. We go through legislative changes together. She helps with analysis. She never says she's too busy to answer a question or provide help, or when we refer people to her. She is just, an angel. And there is no other service like that at all. I can't think of anyone more deserving of this award. And so I'm pleased to announce that we'll be giving this award to Jane Meadis. I'm going to stop my screen share because she's here and putting her on the spot. Jane, would you say a few words?
Well, thank you very much. And I don't know where you got that picture from. That is so old. That was like when I was not coloring my hair. So that was probably in around 2000. I don't know where you got that, but I thought you looked good. It was fine. I want to thank you very much. It's a great honor to be given this award. I've been doing this since 1995. So coming up to, I guess, 30 years soon. When I started this job, I don't think I had any inkling of where it was going, but I can certainly say that over the years that what I have seen and what, the things that we sort of learned, and I went in knowing nothing about long-term care. I came from a mental health background, so I knew about healthcare a bit, but not about long-term care specifically. And the things that we said at the beginning and things that we predicted, I think during COVID especially came true, and all the things that we, had sort of said that, were problems, I think during COVID came up and really grew. And I think, that was the bad thing from COVID, was the fact that so much of this was predicted, and so much of this could have prevented had they listened to advocates, had they listened to their own committees, like out of the SARS committee and different things. But one of the good things from COVID is that I got what I called a lot of COVID friends. And these were people who I met during COVID, who I may never have actually physically met, because, I don't leave my house much, and but who have become such good allies. And I think that one of the one group that has happened with is the long-term care committee at the OHC. People that I think that group, someone mentioned just, I think in the little talk beforehand, how that had, it was Andy, really has come together and really worked well. you know, being able to do things on Zoom has been bad in some ways, but it's been good in others, because it really has been bringing people from across the province together to be able to work together in a way that we really weren't able to do previously, when some people were on a phone and some people were, you know, in person. And so it's been a real honor to work with the Ontario Health Coalition in the way that we have during COVID. And I know that will continue after. And it certainly been a pleasure to get to know Natalie. And we have become good friends and we live close together. So we've actually been able to I have actually physically seen Natalie. But you know, the work is just so important, because this is one of the most vulnerable populations, people in long-term care especially, but any elderly person in the healthcare system, whether you're competent, not competent, whatever, people, the system really tries to take advantage and really does discriminate against seniors in such profound ways in our healthcare system, predating COVID, and of course it's only been magnified during COVID. So it's been really an honor to advocate on behalf of seniors, advocate on, you know, with groups like the Ontario Health Coalition, and, you know, doing things that I think that we haven't done before, you know, putting together projects like the human rights, which didn't work out maybe as well as we had wanted, but I think it was still a good exercise, and we have some other things up our sleeves. And I think that, you know, the more light that's shone on it, and we just have to keep that going and not forget about this population once COVID's over, because that's generally kind of what happens. And, you know, I just want to thank the Ontario Health Coalition for this award. Thank you.
Thank you, Jane.
Thanks, Jane.
Thank you. So we will be putting out a press release tomorrow, Monday, announcing these awards to the media across the province, and we'll send out the details to all of you as well as everything from today. So you'll get the agenda, the annual report, the action plan, and the information about the awards, and we'll also send it out to all of the media. So thank you very, very much, Jane, for your words. Now, is Tara Moriarty with us? I don't think so.
Natalie, to
Yes?
add something to Sandra's Facebook group, it's not just long-term care, it's also home care, because I'm part of her group.
Okay, thank you.
Thank you. I haven't seen any sign in the notes in the chat from
Okay.
Yeah.
I'm just going to go ahead and announce it then, and we'll just do that. Just one moment. I'm going to share my screen. Okay, so Ethel. So Ethel was a long-standing, Ethel Meade was a long-standing community activist on healthcare issues. She held a whole array, and she started a whole bunch of organizations and held a whole array of leadership positions. Her knowledge in healthcare was encyclopedic. She was involved for decades in developing public policy under various different governments to the benefit of patients in all of the areas that she worked in, including her passion, which was really home and community care. She was both a board member and steering committee member at the Ontario Coalition of Senior Citizens Organizations, and she was a founding member of that. She was the vice chair of Care Watch Ontario, which is a group, consumer group for home care. She was the chair and founding member of the Ontario Health Coalition, and she stayed on the board till almost her death. She was a member of the Senior Secretariat Liaison Committee, member of the Ontario Association of Social Workers Committee on Issues of Aging. And so on her retirement from our board of directors, we created the Ethel Meade Award. And this award is to be presented each year at our assembly, given to the person whose research and or policy work has made a critical contribution to public health care and in the fight to protect the public health system. And so this year, we wanted to give the award to Dr. Tara Moriarty. And Dr. Moriarty has done I a staggering amount of work to try and pull together research, the evidence-based research about vaccines, and to educate Ontarians and Canadians en masse to try and dispel false information and vaccine hesitancy through education that is grounded in evidence and through providing safe spaces for people to raise their concerns and ask their questions. I'm just going to stop my screen share because it's so distracting, to ask questions. And so back in January of last year, I saw that she was doing an initiative to ask physicians and others, health professionals, if they would volunteer to help do Zoom sessions, so online sessions that were available to anyone every night of the week, in order to provide a safe space for people to ask questions about the vaccines and get information, real information about the vaccines, believing that if people could have access to real information and a safe place to raise concerns or things that they had heard, that it would reduce vaccine hesitancy, which it actually has done. And they did literally every single day, from January through February, every night they did Zoom meetings. She organized about 400 or more volunteers among this group of health professionals who could, grounded in evidence, give real information and so on, and run these sessions. She was looking for groups that would help her get this out. I offered to liaise with the unions with her, which we did do. And through that, she held sessions for, initially it was PSWs and RPNs and RNs in long-term care and other health professionals. And then through the health system, literally providing those Zoom sessions for tens of thousands of people. And then we worked also to try and expand that to racialized communities, to other communities. She developed information in multiple languages, did radio interviews and a whole slew of things like that. And then as the population got more vaccinated, she took the StatsCan data, the Statistics Canada data, looking at which population segments had lower vaccination rates, you know, shut-in seniors, people from particular demographic groups and communities, and tried to find ways to get real vaccine information to them and also access to vaccines. And she has been doing that all the way through the pandemic. It is extraordinary work. It is, you know, all of her time and spare time. I don't know how they've done it. It's really amazing. So this year, I know Ethel would be proud to have the award in her honor, in her name, go to Tara Moriarty. And Dr. Moriarty accepted the award. She was going to be here today, so I guess something must have come up, but I'm really pleased and proud to give it to her.
Great. Happy claps for Dr. Moriarty. Yeah, no, they were wonderful. And you hear her on the radio. She is so clear and helpful. So she's wonderful.